How are you today? Rachel, can you hear us? All right, we're gonna go ahead and get started here. So today we are going to be talking about um, bringing real world experience into your classrooms, and ultimately, how does that look for you and your students in your specific settings? Okay. Um, one of the A quick aside, some of you are new to this semester's creative conversation, and so it's going to look a little different than it has in the past. If you've attended in the past, we've had the first 10 minutes where we basically gave you a bunch of different websites or articles or blogs to read or research to read, and then we would come back and talk about what we found. Um, while that's nice, and it lets us know what's going on outside of Nebraska Methodist College, it doesn't really let us know what's going on inside Nebraska Methodist College. So we decided as the Create team to kind of make these, we changed it up a little bit. And what we're going to do is this is going to be more of a facilitation where I will ask you all thought-provoking questions, and then all of you will then respond with what you're doing or how you see the answer to the question or something along those lines. So today's topic is about real world scenarios in your classroom and bringing those in. So the first question I have for all of you is this: how do you go beyond traditional case studies to incorporate diverse real world scenarios?
Sometimes I actually have my students make the scenario,
Hmm.
um, but I work with doctoral students too. So like on some of
Sure.
assignments, I'll say give me the scenario, and then whatever the topic is, like if we're working on behavior change, let's say, or whatever, and then I've got prompts for them, but I have them kind of lay out, what does your patient or client look like, what health issues do they have, what, kind of let them lay it out. So,
Excellent. I love that. Yeah. Hi, everyone. Thank you for joining. I just asked the question to everyone. How do you go beyond traditional case studies to incorporate diverse real world scenarios?
I'll jump in. One of
Thanks,
the
Chris.
things we do is we have students bring the cases in too. And so, because they're out at clinical and then bring in things and then, talk about what happened, but, other suggestions they have and get the other students involved with what they think. And the other is, and I need to do this more, but to have our medical director get involved and bring in, his point of view plus, maybe talking about content, but then also talking about cases to illustrate it.
I love that. Thanks, Chris. Right before you
Mhm.
joined us, Jeannie was saying the exact same thing. She has her
Oh,
grad students do that. So,
great minds.
yes, absolutely. So what about those real world scenarios that like challenge their social or cultural bias? Do any of you utilize a specific technique for doing that?
We're actually just about to engage with the poverty simulation through Alicia
Hmm.
Whitehill. And, so more to come with that, but that's my hope with that is that it puts them into a situation to help them to see it from a different point of view.
Yes, I love the poverty simulation. How many of the rest of you have been involved with the poverty simulation before?
Yeah.
Okay. Dixie, Erica, Rachel, any of you have experience with that? Okay, looks like Dixie that has. Good. Yeah, so for those of us who haven't been involved with the poverty simulation, someone share with us what that is and walk us through how that can challenge our students' perspective of the real world.
I can do it.
Well,
Okay,
Uh,
thanks.
they are given basically different characters to portray
Hmm.
for this. Um, some of most of the scenarios or groups that they're acting are definitely of lower economical status. They do work. Some have children. Some are teen pregnant. Single mothers, divorced families, grandparents raising, et cetera, et cetera. But they go to their employment to get their paycheck, and then they're given all of their bills that are due, et cetera, et cetera. And they're basically learning how to pick and choose what is a necessary item, what is not a necessary item, and dealing
Hmm.
with other agencies that are out there in the community to assist. Okay. Housing, loans, pawn shop, uh, um, spiritual assistance, I believe there is there,
Hmm. Yep.
banking, um, transportation. I'm just trying to think of all of 'em off the top of my head, but
There's a lot.
yeah, of different ethnicities that they're also portraying. There's a person who is a thief and robs from them if their quote door is unlocked and can take their money that they were given, et cetera,
Mm.
et cetera. But it just kind of puts them into reality, and some of their reflections in regard to doing this are like, oh wow, really inspirational to read in regards to how much they had learned from it. And then there's others that we all know as faculty members that do have difficulty financially, and this scenario is kind of bringing up all of what they are going through too, and kind of a little bit of negativity towards the poverty sim just because that they have outlived it or have are living it, and do the students take it serious enough,
Mm.
um,
Yeah.
type of a thing. But it's really good. It is, and it definitely meets the undergrad nursing population for sure in regards to knowing all the different disparities and
Sure.
culture stuff like that. So,
Great.
and anybody
Thanks.
else weighs in
Thanks,
too.
Stacy.
well, a few years ago we did it at College Forum, so
Oh,
we all
wow.
participated in it.
Oh.
And I think my character, if I recall, was like a juvenile teen that was not the best kind of kid, and like I had to go steal things and I didn't want to do that. And anyways, and so we did it college wide, and then they've done it. I know that at least once. I don't know. I don't think they do it every year now, but I know one time they did it with the doctoral students when they came in for one of their intensives.
Oh,
Um,
okay.
so, but yeah, we did it college wide, but it's been, oh geez, probably 4 or 5 years ago that we did it at Forum. So we
Okay.
got a lot of new people since then.
How did the doctoral students react to the poverty simulation?
That's a good question. I wasn't at that actual intensive, so I
Hmm.
don't know what their uh, summary was or whatever, but I just know they did it with them.
Okay. Okay. Do you think that's something that they or you or your program would be interested in doing again? Or
I don't know, that would be up to more Alice and them, and I
okay.
know that those intensives are pretty full, the way they
Right.
are, so I don't know. I can't say one way or another, but
Sure, sure. Okay, cool. Yeah, thank you for sharing, everyone. So then, one of the things that's really important, especially if nursing students, um, is to be interactive with them and to actually help them learn how to actually do the skills that you've already taught them about. So, how do you use simulations or role play or patient-centered activities to engage your students?
Well, for us in respiratory care, we use the human sim lab, not
Sure.
not as much as I'd like, but and I know nursing undergrad definitely uses that too. But that was really helpful in picking up, some of the gaps with professional communication. Like they're pretty good about talking to each other, but like one student noticed the blood pressure dropping on the system, but didn't say anything, on the simulated patient, but didn't say anything because, oh, I don't give the blood pressure med. It's like, no.
Oh,
You see a problem, you talk about the problem, it's like, but that was an eye opener to me that, they felt kind of trapped in their roles and, trying to give them more either interprofessional or more uh, real world. It's like you can stand at the front of the room and say, oh, you need to talk and you need to be
yes.
part of the team, but until they get to practice that.
So, Chris, did that help? I mean, what did you do once you realized that? Is that something you like kind of created a lesson around, or did you stop everything? I mean, what was your reaction?
That's a great question. I'm still uh trying to get better, with doing those kind of simulations, but
Sure.
uh we didn't interrupt him. We let him keep going and, until somebody noticed that the patient's blood pressure was tanking, but we debriefed afterwards
Oh,
and
good.
we said, "Hey, I noticed that you saw this. Uh what else could we have done?" And and to just literally give them permission to be a part of that situation.
I love that debrief. And so they like had a reflection on what they did in the moment.
Right.
Oh, good.
Right.
That's great. But what about in an online environment? I know that in an online environment, that interactive learning is a little different. What are some ways that we can use role playing or patient centered activities in an online environment, or what have you?
Can I push that question over to Jeannie? I don't know if you want to talk about the
Right.
coaching course.
Oh yeah, in the coaching, so one of the things that we did in the coaching course is we partnered students up with another student and they had to coach each other. And so what they did was they met virtually via Teams and on a time that was convenient for both of them. And basically what I did was I had them like figure out the time and then let me know, and then I scheduled it so that it was on my calendar. I didn't attend, but then that way I had the recording because I had them record it. And then I watched the recording and gave them feedback and graded and so forth. So that worked really well. And then we do a lot of in a lot of discussions,
Hmm.
and some of those it's bringing, the questions are posed where, share a time when XYZ, whatever the content is, um, or that this has happened in a situation. And again, with the doctoral students, they've got a lot, maybe some more life experience and work
Right.
experience sometimes than undergrad students might. I mean, not always, because we have a lot of non-traditional students and a lot of working students, but so a lot of times we have them bring in their experiences into the discussion, or assignments and things. But
Okay, great. Thank you. Anyone else want to hit that interactive learning, what you do in your courses?
One of the things I like a lot, and again, I'm just starting to get into it more, is the Kahoot. And I've done mostly as
Mm,
individual right now. I haven't done teams because I've got, 3 or 4 online on most days, and then the other 5 in the classroom in our main professional year group. But they really get a kick out of that. And there are some pre-made ones that are good sometimes. I've got a couple with
sometimes.
wrong answers.
Yes.
I'm like, oh, don't put that one up. But yeah, and you can edit ones too that are out there from other people, most people that
Yeah,
post stuff, but that they really do get a kick out of that. And I'll do it like as a review or as a way when I'm introducing information to see what their understanding is as I'm going through it.
that's great. That's also a great way to kind of bridge that gap between those that are in your class and those that are online as well, because they can all take that Kahoot at the exact same time.
Yeah.
Yeah, I love that. Thank- Thanks. So let's talk about community immersion then. So how do you, or do you integrate service learning, shadowing experience? I mean, obviously we all have clinicals and things like that, or something similar, I would think. But service learning, shadowing experiences, community partnerships, how do you work those into your courses or your activities?
Oh, one of the things we do in respiratory care is we work with the American Lung Association, and they have
Mhm.
some programs to help train people in general information related to lung disease. Like they have an asthma basics course that's maybe an hour that I introduce the students to in the fall, and then they um, have something that, if they want to recommend it to someone else later, that's just real basic. It's not, like
Sure.
at higher college level learning. And then this semester, we're trying something new. We're following up, and they're training the students in to be facilitators for courses to help kids learn about their asthma. So the
Oh, cool.
students are becoming facilitators. And again, it's all, kind of in progress right now, but I've had the
Mhm.
students do the online learning, and in a couple weeks, the trainer from the American Lung Association is coming in to help the students build their skills so they're ready to facilitate classes. So I'm working towards doing an asthma screening at the Lydia House. But again, Alicia Whitehill is a huge help with, Kylie is of course too, but Alicia's really been out there helping us with that. The other thing we did last fall that was, I think, really high impact for the students too, was going to, and I can't remember the name of the center in Council Bluffs, but it's uh, for a homeless shelter, but also somewhere people can go during the day. And something I'd never experienced before too was I think they call it low barriers, because sometimes people are turned away if they are using alcohol or, or other things,
Right.
but they were trying to take down barriers. And so as long as somebody was cooperative, and getting along with other people, they were letting them into the shelter. And they had just I'd never gone into a homeless shelter before. We donate or we do other
Mhm.
things, but to actually be present. And then we did COPD screenings, and Alicia helped us with, setting it up, and
Wow.
then having a physician over there in Council Bluffs, pulmonary physician who would follow up if we found somebody, which just about everybody. Whereas I've done it maybe at a community center before, and you get maybe 1 out of 10 people have trouble and need follow up, where it was kind of the opposite. Anyway, I know I'm going on and on, but
You're okay.
she's just such a great contact, because it's like, oh, there's all these things we want to do, but you never really have time to be the one to set all this up. And
Mhm.
and she's been a great facilitator for that with her contacts.
So, what was the student's perspective on that activity? Um,
Yeah, it was very interesting because some of them kind of held back, and others were, really engaging in it. But I think again, a lot like mine, I had never personally gone into that
mhm.
setting. It's like, oh yeah, it's a good thing, but it's like never uh, looked at people, and it's just like anybody else. They're talking. That was the comment that came up from several students, it was just like any other patient I've, worked with, or any other um, community member I've worked with. It wasn't that different going into that environment.
Right. So it sounds like it was very eye-opening.
Yeah,
Yeah. Oh, that's fantastic. Great.
yeah, it was very good.
What else do we have out there for community immersion?
Dixie, do you remember the interprofessional day that the students used to do?
I don't recall that at all. That might be before my time.
I don't know.
Oh,
It was just a few years. I think it was just maybe pre-COVID. I just remember I went to, it wasn't my students, but I went and helped. I think it was some of they needed another person with the sonography students, and they weren't, but we went to, I think the open door mission, and there were like different stations, and different students worked different stations, and the people came through, and I can't remember, like the sonography students weren't doing sonograms, but they were doing some type of an assessment and interviewing the people. I just remember it because I was the same way, Chris, that I had never actually been into a homeless shelter, and it was very eye-opening and just a really cool experience for everybody. But it was just neat that I can't remember what all they were doing though. I think nursing, they were doing all sorts of different assessments and things, the students, and it was interprofessional, so there were a lot of the different programs there. I wish I could remember more. I just remember because they needed to fill in at the last minute. Someone couldn't go, so I just went to help, and
Mm.
it was really cool. But
If it
sorry,
was
I don't have more details.
if it was pre-COVID, I wasn't with the college at that point in time, but I do know in the nursing level 300, the students do go out into the community and visit all of the different, well, not all of the different homeless shelters, but they deal with homeless shelters, with other community agencies. I don't want to say they really get involved with interdisciplinary. That's one thing I would like to see the college have more interaction with in
Mm-hmm.
regard to that. But I do know the students are exposed to different um, cultures and determinants of health throughout their whole college experience, at least with nursing.
Sure, I love that. Yeah. What do they do at like the graduate level for getting into the communities and service learning and that kind of thing?
That's a good question. I don't know about uh well like I don't think they have a lot of community service required hours.
Okay,
Now, some of the students have clinicals, like the DMP students have to go out and do clinicals.
sure.
And then actually all of the doctoral students with their doctoral scholarly project do some sort of an intervention somewhere. I mean, sometimes it's within the community, sometimes it's within a workplace, sometimes it's within a hospital. It's
Okay,
just, it's all over the place. It's really, so that I suppose would be more of their um, community, and I could be missing something too that I'm unaware of. Um, but yeah, I don't think it's like with the undergrad where they have that community service requirement. I don't think, but I could be wrong. It might just not be in a class that I've taught before. So
oh, okay, sure,
Yeah,
sure.
and I think it's program dependent because I've heard Melissa talk about the OT students, getting involved. They have and I'm trying to remember what they call it, but essentially it's a place where they keep equipment that they loan out to the community.
Oh,
So
sure.
I know several of their students are working on that project and having that available. So, say somebody needs a walker and wants to borrow it from their equipment loan out program, they get the equipment ready and get it to people.
Oh, that's great. Yeah, that's
Yeah,
cool.
yeah,
yeah.
yeah, I
I'm not
totally
sure if
agree.
that's
It's
through Methodist
the
or yeah.
program to yeah, it is. It's actually down, and it's down in the building right below the hospital. I think it's 8101 or 8301, or I don't know what
Mm.
the, but
So it's
it's right.
convenient for people. Yeah.
Yeah, and then I think they also, like, they have field work, and then I know that they do group, like one time one of the groups did something for our wellness thing on campus, like, so I don't know if that's all community related, but I know that they do go out and do different projects and things. So Melisa'd be obviously more knowledgeable on that, but
Sure, sure. Yeah, thank you for sharing though. Okay, so I guess kind of sticking with that community idea or vibe, what is the process that you all have for like inviting practicing nurses or researchers or community health advocates into your classrooms? Do you have a process? Do you invite guest speakers? What does that look like?
We don't do it very often, but it really has opened up a lot for us with doing Microsoft Teams, to be able to have students visit with people more. It is interesting. We haven't done it a lot, but we've had maybe 1 or 2 guest speakers this semester, and they're interested in coming into the classroom, which I know is harder. It takes more time out of their day. Like we had one of the practitioners come over, one of the respiratory therapists from Madonna, which is out in far west Omaha, and give the students a presentation related to tracheostomy and tracheostomy care for patients.
Okay. That's cool. And so how did you find them? What was the process? Is that just a connection you have through?
Yeah, it was interesting because it's somewhere the students go for clinical, but the folks from Madonna offered to do it to help the students have a better grasp of just the variety and the kind of an introduction for the students before they got there, which was great.
That's
But
awesome.
it came from their suggestions, so that was nice.
Cool. Kristen, Erica, Rachel, any of you ever bring in guest speakers? Someone from certain expertise that you want the students to really focus in on?
In the clinical setting, we've had like the clinical education nurses come and talk in our post-conference settings. Sometimes, with the critical care nurses, they have like patient room that isn't used and they have set up to be able to utilize for a sim room, and we've utilized that this semester already with our 400 students.
Oh, cool. Oh, I'm sorry. Go ahead.
No, they get to see a couple of lines that aren't always used in the ICU, but we talk about it in class. So stuff like that. And yeah. And then they come and talk to, one of them came and talked to them about like the importance of RRTs and recognizing signs early to rescue a patient before something critical happens and stuff. So.
And did you have to go find them to get them to do that, or did they offer like similar to Chris's situation?
The RRT one that they kind of offered to come and talk to it because she's pretty passionate about making sure that new nurses entering the field recognize those signs early and know that they can call for help and where they can get help from and stuff. So.
Okay, great. Love that. Thank you. All right, Jeannie, what about yourself? What do you utilize guest speakers at all, or are you more of a no? We got too much stuff to do. I don't know. What's your plan with that?
I think, well, personally in my classes, I don't think we really have used guest speakers too much.
Sure.
Now in like my student group, the LMIG, we have done guest speakers in that.
Okay.
I'm trying to think though. Yeah, I don't know as if in classes we have. No, but maybe we should. Although it depends on what classes I'm teaching. Like if it's
Yes.
doctoral classes, I don't actually create those classes. So,
Oh, so then you're left
yeah.
at the will of someone else creating it usually. Yeah, that makes
Right.
sense.
Yeah. Or
Yeah.
like my lifestyle medicine class, it's really full. And I don't say I use guest speakers, but I also use like documentaries and things. So,
Oh, sure.
so that I send them out to other, experts, I guess, in a sense.
Yeah, so I mean that's so in a roundabout way, you are using guest speakers. It's just your available, their availability probably doesn't match yours, and so it makes sense that you utilize those documentaries. That's great.
Right.
So tell me more about the LMIG group that you were just mentioning, and the guest speakers you get for that.
Okay, sure. So the LMIG is the Lifestyle Medicine Interest Group. So it's a student group on campus. So like one of the things we had one of the primary care or nurse practitioners from Element Primary Care. So they practice lifestyle medicine and functional medicine in their practice. And so we had one of them come in one time, and we did a team session on just having her talk about what it's like to practice lifestyle medicine in the clinical setting. How did she set it up? How does she bill for it? Those kinds of things. We had Gina Wagner come in. We did a stress management thing. So she walked everybody through like some yoga and some stress
Nice.
management techniques. We had one of the former grad students who was also a grad assistant. She did a stress management thing for us one time. We also did so there's a documentary that's plant-wise that there's a Nebraska physician, Dr. Amanda McKinney, is actually in the documentary. So we
Oh,
did
cool.
kind of like a watch party, or we either like we had people watch it then or watch it prior, but then Dr. McKinney was there for a live Q&A afterwards. People could ask her questions, so that was kind of cool. I'm trying to think what else we've done with
Awesome.
that group. I mean, me and one of my former employees was one of the speakers one time about exercise and social connections, and so yeah, those are some of the things we did.
I love how you mentioned bringing in a former student who is now out in the workforce and coming back and having them teach. I mean, that's fantastic for our students to see that connection and, okay, I see where this can go. That's great.
Yeah.
Chris, it looked like you had something to say before we got into that.
Weird on my face, yeah. I had thought of something else. I haven't done it in the last year, but I used to have equipment vendors. If there was a new cool piece of mechanical ventilator or something that, we don't have 90,000 for, but they were willing to come in and show it and tell the students, and also talk about their career path too, that they'd been maybe working in a hospital as a respiratory therapist and gained this expertise and went on to work for that particular company. So that's always a nice tie-in too, that the students see something new and cool, but also hear it from that person's perspective.
Oh yeah, yeah, I love that. That's great. Thank you. Okay, so let's talk critical thinking now. Okay, we're gonna switch kind of tracks a little bit. So how do you encourage your students to critically analyze healthcare policies or ethical dilemmas or possibly conflicting research findings? Or do you?
I hate to, I'm not talking too much, but we have an issues and trends class that's just a short 5-week class, but it gives them a chance to specifically do that. We try to weave in, cases and examples along the way, but this makes us be specific, that we make sure we go into it. So we'll bring in some ethical cases, have the students write reflections about that. There's a presentation from our national professional organization that helps me with kind of a jumping off point on that too. And then I had a video I wanted to show them to help them understand um, determinants of health, social determinants of health, that came from the CDC. And in watching that, I found a little subsegment of it that talked about the Tuskegee experiments.
Oh my goodness, yes.
Yeah, and how that moved forward to actually help us to now have not just guidelines, but standards in place, so that you can't just do what you want with anybody without having some oversight on that. But the interesting part about this little part of the video was it talked about Dr. Bill Jenkins and how he became aware of this, I think, like in the 1950s, early 1960s, and he started raising the alarm that this was going on and how nobody paid attention. He was African American. He was a graduate, I think, of Morehouse, and one of the first doctorate folks to work in the national health system, if I remember right. But the story was so powerful because he brought it to the media and nobody was doing anything to make it different. They weren't stopping this horrible Tuskegee experiment that was going on, and how he finally got one reporter to break it for him. And then that changed the course of history from there.
Mm.
Yeah,
Yeah.
good movie.
Right. Well, it's a good thing we have, things like IRBs now, right? Those internal review boards. I mean, I'm actually on the one here for Nebraska Methodist College, and just yeah, the protection of the participants is of utmost importance, and it's amazing what people did back in the day, right? Not in a good way, but amazing from like how could you think that was okay?
Yeah,
Right?
exactly.
Ever. I mean,
And to me, the power of one voice, of one man who
yes.
kept after it, and I'm sure he had other people who cared about it too, but he didn't let it go when somebody said no. He kept saying, this is not right. We need to make this different. And then they talked about his legacy too. I think he passed away just a few years ago, but how I think it was 700 different people of color he had mentored and helped get through graduate degree programs, or helped to encourage them into completing doctorates and going on to lead schools of public health or things like that. I mean, it just, that power of one is pretty cool to help the students to see that.
Yeah, there is a great PBS documentary that came out several years ago about the NFL and concussion protocols, and
Mhm.
how the gentleman, and I'm gonna miss his name, and Will Smith played him on a movie, but he was a doctor working and he's an expert in brain injuries and brain trauma, and he raised the red flag and said, "Hey, I think you have a problem here, NFL." And it kept getting pushed aside, and pushed aside until probably 10 years later, I think, where enough people finally got together and went to the NFL and said, "Hey, there's clearly an issue." And so now you see all kinds of health protocols in the NFL based on concussions and brain issues and trauma and that kind of thing. So that power of that one voice, yes, you're correct. What about the rest of you? What do you do to encourage students to analyze critically, like healthcare policies or ethical dilemmas, those kinds of things? Or even conflicting research. I mean, in today's society, I mean, anybody, not anybody, but there's a lot of conflicting research out there for, I mean, even climate change or whatever it is. Do you do anything along those lines? And if you don't, do you have ideas of maybe things that you would want to bring into your courses?
I'm in the I teach the global health class, that the 401 global
Okay.
health class, and they have a couple assignments where they talk about like climate change or healthcare policies. Like they pick from a list of different healthcare policies or organizations that are involved in making policies, and kind of review them and pick one that's interesting to them. And it's a discussion post, so then they have to respond to peers, so they get a lot of different experience or a lot of different exposure to different types of things.
That's cool.
So yeah.
Who else is in that class with you, Kristen? Is that a co-taught class or course?
Yeah, Joy has the other section. There's two sections of it. So I have
Okay.
one and Joy has the other section.
Okay, cool.
There was a good assignment. Ashley Kemian is in the Masters of Healthcare Administration courses. I think it's a course maybe Whitney's teaching, but she was telling me about this assignment because she thought it was so cool. But it was essentially having the students write a letter to the editor about a health-related bill. And this was, I think, one that was getting funding for mental health education for teachers, because then the teachers are with the students and hopefully affecting more. But
Yes.
that whole, I hadn't thought about that before. I've maybe had students click on a link if they want to influence something through our professional organization, and the link clicks them into a state senator or a representative or so on, and it gives them kind of a form letter. But this was the student creating a letter to the editor, bringing up important pieces of why that bill was important, why should we care about it, but something that really could have a great local effect that, just showing the students how they could make that difference.
Oh yeah. Yeah, that's awesome. Yeah, I heard something today on my way into work about how there's new research out there about how um, connected a CEO their mental health is to the overall organization's outcomes and goals and things like that. And if they are not great with their mental health, you can kind of see that trickle down through the organization. Yeah, it's fascinating.
Wow. It made me think of what you hear with moms, that if mom's mental health is not good, it affects the
Oh,
whole
yes.
family. Yeah, like
Hmm.
parents.
Okay, so let's talk about communication and collaboration. So, how do you cultivate? And Chris, you kind of hit on this a little earlier today with your student about, well, that's not my area. Blood pressure is not me. But how do you cultivate communication skills? Whether it's talking with other nursing students or let's talk about navigating difficult patients. What are we doing to teach our students about that?
Spencer, could you repeat that? My dog was barking and I didn't hear it.
Yeah. So, how do we work with our students to work on their communication skills, specifically to either talk with other nurses that they're working with, so that they feel like they have a voice and that they're not just someone on the side or this is my specific job, or how do we teach them to talk with difficult patients or difficult patient interactions?
Well, in the beginning, they learned the therapeutic communication skills and the nursing 100 level. And then
Okay.
as they advance in 200, we stress the importance of what we call SBAR report. So in at least um, what 200 level does is they have the students practice giving report to quote a physician and
Hmm.
the post clinical activity a lot. And not only that, but they really are in communication not only with faculty, but with their co-signed RN in regards to issues that are occurring. And some of the, it's an evolving process that each week they spend in the acute hospital setting, they get more and more comfortable with it.
Sure.
So
Yeah.
it's continually growing, but that's what I know what we do in the 200 level. That's one of their post clinical conference activity is practicing giving SBAR and going from there. But they do learn the SBAR report system or communication system in the 100 level, and they implement it more in 200. Do the student nurses ever get to call a physician? I'm not going to say no because I know that they would do that when they're doing their preceptoring.
Mm.
But in the 200 level, no, because they are just now getting into an acute hospital setting. So they're um, very, very leery of just going into patient rooms. So
Sure.
we're getting over that hump a little bit more versus caring for individuals who happen to be in a rehabilitation hospital or long-term stay facility. I know, Erica, you might be able to talk a little bit more in regards to that too.
Okay, what about Kristen? Kristen, what do you see at the 400 level? Are they definitely more confident at that point, getting into people's rooms and having conversations with the patients, with the other nurses, that kind of thing?
Yeah, I don't have to push them into the rooms. They're going in the rooms and jumping in there. And I actually have to pull pull them out of rooms to be like, you have to come do your charting and your paperwork too. Like they have to
Right.
learn that prioritization at this point now. But we encourage them to go with their nurse on the critical care floors. They do interdisciplinary rounds every morning. And so they go in the first couple times that they're on the floor, they go and observe kind of the process and stuff like that. And then I start encouraging them to like with their patient work with their nurse about what needs to be said, and then doing that like presentation themselves. And so they're talking to the physician, the care manager, the therapy people that are in the room, pharmacies that are in the room, and all of that. And then they see some difficult conversations with family members, palliative conversations, end of life conversations, and they get involved in those types of things and that at that level too.
So what does that look like from the faculty perspective? Is there something like programmatic that happens through 100, 200, 300, 400 that the students are prepared for to deal with those kinds of conversations? Or is this more of a course specific kind of dealing issue?
I don't know, like the difficult conversations and like comfort care, like compassionate extubation type of conversations. I'm not sure, like those are first time experiences probably at this level for them. I'll pull them aside either before or after and kind of have a conversation with what, like if it's before, what types of things to expect in that conversation, what types of potential reactions they may see family members, depending on what we've heard nurses say the family dynamics are like. Afterwards, we'll pull them off and have kind of a one-on-one debrief about what they saw, what they felt about it. Had a couple who have been able to participate in end of life cares and
Sure.
stuff like that after a patient passes. And so I definitely take the time to pull them off the floor and make sure that they're able to process what they saw, especially if it was the first time that they have experienced a patient passing away or anything like that. But it's a tough conversation, but it's one that they're going to eventually encounter in most areas of nursing where they go. And so
Yes.
I encourage them, if they're able to handle it, to get in there and do it and witness it. So
For sure, yeah. So then the other side of that, or I guess moving up the ladder or through the field of education, would be the graduate level. So what does that look like at the graduate level? I mean, as you said, Jeannie, already, most of them have kind of seen the real world already. So is that, does that ever come into your conversations or in your courses or anything like that, dealing with those difficult patient interactions?
Yes, it would come into play in different courses. So, not always patients, it might be colleagues or students because, like, so the EDD
Right.
students, for example, aren't necessarily in healthcare. So like the leadership class that I've taught several times, there are different discussions with that. But I also, right now, I'm teaching a undergrad class in the bachelor's in management, the healthcare management, and we had a really cool discussion. The discussion was actually on like perceptual distortion, and there were different ones in the book, and they were supposed to pick one and talk about when they had a perception of someone, that was actually distorted. And so it happened that the students talked about, a couple of them talked about how they had how clients or patients, like one works in a clinic and another was a client, but how they were angry about something, that wasn't obviously that person's fault, but they took it out on them. And so just trying to, just having the discussions and seeing how they processed that, and then also having the discussions of, they probably weren't really mad at you. It wasn't you. It was a situation. You just happened to be the person that was there.
Yes.
But I also would just like, I usually do the portfolio reading, and that's one of my favorite things to see is their growth in some of those communications, or how have some of them say that, they're like, this person just needed someone to unload on, you know? So,
Right.
and I think we all need that reminder, because I still do that sometimes myself. Well, I'll be like, well, why are they yelling at me? Or, you know, and
Mhm.
it's, you know, it's, but stopping to think about, well, they're not really, it's not me, it's the situation. So,
Right.
um, so yeah, that was a really cool conversation with those students, discussion that we had. And I'm trying to think, like, yeah, doctoral, they bring it, I mean, we have a lot of discussions that they would bring things in on.
Mhm. Great.
Oh, and the research one, kind of back your other question,
Uh-huh.
part of like looking at the different research. So part of it is just also reminding students or helping them to remember to go to the original source. So a lot of
Ah,
times, you know, like
yes.
they'll use a source. Well, that source is citing someone else who might be citing someone else. Like I've even call it now indirect citation, not even secondary, because sometimes it's 3, 4, or 5
Right.
down the line. And, you know, so that's a big piece, is just reminding, you know, is that the original source? Because it's
Mhm.
kind of like the telephone game where you
Yes.
whisper in someone's ear, and that, you know, when it comes back out, it's not always what this person said. So that's a big thing with research. But I have
Huge.
a really fun assignment in my lifestyle medicine class. It's one of my favorite assignments, but it's one of my favorite topics, where they have to, they're in small groups for this discussion, and they pick, there's a list of like chronic conditions, and they can pick, as long as there needs to be at least one student for each condition. And they look at like nutrition, the research on nutrition as medicine for that condition. And then they go back and it's discussion, and then they have to read everybody else's. So they get a lot of education on all of them. But it's really fun because they might come in with the perception on what like nutrition, but then after reading the research, they realize that you know, their thoughts were maybe
Right.
not what the research shows is the best. So
Mhm.
it's really kind of fun. But and we try to have them, if they can find conflicting research, you know, to find those different articles and then really
Yes.
analyze it. So
Yeah. Love that. Thank you for sharing. Okay, so we've talked about, dealing with difficult people. So then the last question is, so there is a real reality about, stress or burnout or the trauma that nurses face on a daily basis. What is it that you teach your students on how to self-care, take care of themselves?
That's a great question, and I think we've been talking about that with the core curriculum information too, on how do we bring that in better. It's how do they do that holistic
Mhm.
self-care and also recognize it in others too, so it's looking at themselves, but also, what can they do to help other people with holistic care.
Mhm.
So we're not there yet.
No, no. Yeah.
Yeah.
Well, and that's one of the reasons why we have these conversations, is because it, gets us thinking about these things, right?
Mm.
Um, on top of going into clinicals and seeing things that might cause them, trauma or burnout or stress, they're also taking part in the courses and having to learn the material and things like that. So yeah, it's something that I think is very important and influential for our students.
I have a couple classes that, I mean, just the content is so conducive to it, like lifestyle medicine.
Sure.
So, for example, we give them a lot of assessments, the American College of Lifestyle Medicine assessments for the different pillars. And so I do, it's not an assignment, but I recommend or encourage them to take the assessments themselves, and
Hmm.
then to kind of make themselves a plan for you know, maybe if there's an area of wellness or lifestyle that they want to work on during the 10 weeks of the course. Or in the coaching class, we also, you know, they coach each other. So that's a good piece that comes out, or, you know, they oftentimes that helps with some of their self-care, because they're supposed to coach on something that they really want to be coached on, you know, that they're want to work on. So that's kind of a good, but those topics just really lend themselves well to those things. So
Great. Kristen, Dixie, Erica, Rachel, is there anything that you do specific in your courses to talk to your students about stress, burnout, trauma, self-care, those kinds of things?
It is not in 200 level specifically as a course lecture. Um, there's just so much other information, and I know,
Right.
I know that ah, Campus Health promotes their Friday mindful mindful moments or whatever. That
Hmm.
is great. We do, as the semester gets going, and before exams and other things, it's don't forget, you do need to still take care of yourself, but it's just kind of
Right.
it's really hard. I don't know what the other ones do, if it's specifically taught. It's just, don't forget to take care of yourself. Sleep's important. uh,
Hmm.
don't be staying up all night, cramming before the exam. That's not how you study. That's not how you're going to be able to retain the information. You're not memorizing it. We stressed a little
Right.
bit. Specifically, a lecture on it, no.
Sure. But it sounds like it's interweaved throughout, though.
It is at time, but not intentionally structured in.
Okay. Cool. Thank you for sharing. All right. Well, we have 1 minute left, and in that minute, I want to thank you very much for all of your participation. I hope you like this new format. If I need to give you the Dove credits the website, the link for that. So don't go anywhere. I will get that here in just a second for you. I will put that in the chat, and then we will all be done. So again, thank you so much for your participation, and I will see you on um, the next chat, hopefully, the next creative conversation. All right, let
Thanks,
me
Spencer.
find- You're very welcome.
Thank you, Spencer.
Oh, go Hufflepuff.
Have a good weekend, everyone. Go what?
Thanks for
Hufflepuff. That's Kristen's shirt. She's wearing a Hufflepuff shirt. So
Oh,
Spencer, thank you for providing the link.
yes, I will. Yes, I will find that, and I will get that in here. So
'Cause otherwise I forget to do it. I don't know if anybody else does, but I certainly do.
Yeah, me too. Me too.
yeah.
Is that on our faculty information page too?
it
is
will
so-
be.
I
Yes.
never go there.
Okay, yeah, I gotta buzz off to another meeting, so take
Okay.
care, guys.
Have a good weekend, everyone.
You too, guys.
Yeah, you too. Bye. You know what? It's recorded. I'm going to just email everybody because I also have another meeting. So I apologize that it's not readily available, but I will get that out to everybody. Okay.
That's all right. Thank you.
All right. Yep.
Thank you.
Thank you.
Have a good day. Bye.